I'm joined by Gary Patterson, Patient Access Director at Essentia Health. Gary's participating in an upcoming panel on point of service collections taking place July 18th as part of our Patient Access Foundation of the Revenue Cycle program. Gary, thanks so much for coming on today. To get started, could you perhaps share a little bit about your background with us, how you got your start in healthcare and your current position?
My background in healthcare, actually, I started in a sales position right out of college, and I was miserable at it. So I took a position in a hospital doing bed control and access management, and absolutely loved it. Loved the pace of the hospital, loved that no 2 days were alike, and so pivoted from sales to healthcare finance. Very quickly rose to supervisor director, and I have been in that role for most of my career. The last 8 years, I've been doing a lot of interim management roles for various organizations across the United States.
Well, sounds like you made a really good choice transitioning from that sales position into healthcare finance.
Yes.
You're coming to join us at our patient access meeting this July on a panel focused on point of service collections. Could you share with us just one thing that you're working on within your current organization to improve those tough point of service collections?
In our organization, we are trying to absolutely make it easy to do business with. We find more and more that healthcare consumers are able to do a lot of things in their life via their telephone or via an app or via the computer. And they want to do the same thing with healthcare. They want us to be able to tell them what they're going to owe, be fully transparent about what they owe and why they owe it, and push that out to them ahead of time. They also want us to offer affordable payment options so that they have a bill that's larger than they expected. They're able to handle that in their lives and make those payments, on a monthly basis that are affordable and make sense.
I think those are such great points, and something that we're discussing at the meeting, that really transcends patient access is this idea of, you've got to have everything right. So the estimates need to be going out. People need to see how much they're going to owe. They need to have the right insurance so that their copays and their payments are all aligned, and it's really difficult. But something that is really important, and consumers, will be more engaged when we get those pieces right. Thinking about the overall meeting, that the patient access program, is there anything that you're looking forward to either benchmarking or discussing with peers during that upcoming program?
I would like to hear how other peers are making it, again, easy to do business with. Patients understand that they have an out-of-pocket, but they often have a hard time finding out what that's going to be from the hospital or the physician's office. And so what tools are they using to quickly determine that and then get the information back to the patient? No one likes a sticker shock or a surprise bill in the mailbox. Everyone wants information timely and transparently. So I'm looking forward to talking with peers and seeing how they're doing it.
Definitely, and I think that we'll be discussing that quite a bit, whether it's sending out letters and snail mail, or using technology to email and text message and get people onto the MyCharts portal or whatever you may have to get that information out there. Well, again, we really look forward to having you on the panel coming up July 18th. And thank you again for joining us today.
Kate, thank you so much. I look forward to it myself.
Thank you.